Hi everyone, welcome. We're just going to give everyone a couple of minutes to join us and get settled in, and then away we go. All right, we're at 12 o'clock, so I want to be respectful of people's time. Welcome everyone to this community conversation. My name is Helen French and I'm the Director of Development and Continuing Education at NASW, New Jersey, and we're really pleased to see you here, some familiar and friendly faces. Just a bit of housekeeping. When you signed up for this community conversation, you agreed to a code of conduct, and we expect you to be respectful to each other and to our presenters, which I know you're going to do because you're professionals. So we are really quite honoured that we've got the representatives from the Department of Labour in New Jersey to talk to us about the New Jersey paid family and medical leave during COVID. They want to have, they welcome your questions. So, but we're going to ask that you leave your questions until the end. But during the chat, you could put your questions in the chat or raise your little yellow hand. We're really pleased to have Rebecca, Nicole, and Holly here. I'm going to hand it over to Holly, and she's going to introduce everyone and start the program. Thanks so much, Holly.
Thank you, Helen. Hi, everyone. Rebecca is going to get our slides up. We're going to start sharing those. In the meantime, I just want to say thank you to the National Association of Social Workers, New Jersey, for having us today. Thank you to Helen for all your work to host us. We love NASWA. We have been to your conference tabling to share information in the past, and we really appreciate all your work. And thank you to all of you for attending today to learn more about paid family and medical leave. We're really excited to share some information with you, to hear your questions, and to hopefully provide some helpful resources. So my name is Holly Lowe. I am the Deputy Director for Strategic Planning and Outreach for the department. I'm going to do some of the slides today. I'm joined by Rebecca Glynn, our Outreach Program Coordinator, and Nicole Risco, a wage and hour field investigator. They're also going to be covering some of our slides. And we also, I believe, will have our policy director, David Bander, on the line, who likes to join us for the Q&A portion to pitch in. So before we jump in, just want to share that our mission is really to raise awareness and equitable access to paid family and medical leave in New Jersey. That is one of our office's important missions. And social workers have a critical role to play in that as you assist families day in and day out on the front lines. And so today we invite you to consider these programs not only for yourself as an employee or for your staff as employees, but most importantly for your clients. We really hope that you can help us in being ambassadors for paid family and medical leave to help individuals make the connection to these programs when the need arises in their lives and their loved ones' lives. We do know that in New Jersey, these programs have been around. Earned sick leave is somewhat new. We're going to cover that briefly. And paid family and medical leave has been around for quite a while, but we still have a ways to go in terms of raising awareness. We know that communities of color and those earning less than $100,000 a year are less likely to know about and have access to these programs for various reasons. So we're working hard and we'd appreciate your help. We also would love to hear your feedback. Outreach is new to our department. you have a very important perspective that we would like to hear in terms of our materials. Are they sharing the right information? Are they answering the right questions? Are they in the languages that we need and the like? So we do have a survey that we're going to ask you to complete at the end of our program. I'm going to go ahead and drop that link in the chat, and Helen will also share it with you over email in case you have any trouble with that link. Okay, so we can get started. We have a disclaimer that I'll quickly cover to say that this information is intended as general information only. We're providing this as a public service, and you should be aware that while we try to keep all of our information timely and accurate, there's often a delay between official publications of materials and modifications of these pages. So we can make no express or implied guarantees, and the Register and Administrative Code remain the official sources for regulatory information published by our department. And we'll make every effort to keep this information current and to correct errors brought to our attention. Next slide. So we want to share with you the mission of our department. We are dedicated to protecting our workforce, strengthening our businesses, and promoting the dignity of work. And as Helen mentioned, as we dive in, just to be clear, we will share these slides with you afterwards. You can refer to them. And again, please feel free to put your questions in the chat and we'll address them at the end of the presentation. So as we all know, New Jersey workers need time to give and receive care now more than ever due to the pandemic. And in New Jersey, paid family and medical leave benefits can cover illness, whether physical or mental, injury, pregnancy and childbirth, bonding with a new child, caring for a loved one, and coping with domestic or sexual violence. And we always like to touch on why paid family and medical leave is so important to individuals in our state. Paid family and medical leave can provide economic security to individuals and families. We know that in the workplace, it increases productivity and reduces turnover. It can speed up workers' recovery from medical conditions and prevent relapse. For babies, it can decrease incidence of low birth weight, preterm births, and infant hospitalization when their parents have access to paid family and medical leave. It can reduce maternal stress and depression. It improves women's workforce participation, and it can improve the division of parent responsibilities and household work, which promotes gender equity, and it may slow the spread of a pandemic. I was just reading this week as well that there's new research about paternity leave and how paid paternity leave can help reduce income inequality, which we know is a huge issue we're facing. So although the United States is the only advanced economy in the world without a national policy, New Jersey is one of the few states that does have paid family and medical leave. So we're quite lucky to have it. So as we dig in, it's important to note that in New Jersey, paid family and medical leave isn't just one program or law. It's actually made up of 2 public insurance programs, temporary disability and family leave. And it's connected with federal and state job protection laws. Those are the laws that give you the right to take your leave and return to your job. And these are closely related to one another, and we'll dig more into that later in the presentation. So we're going to share some of the basics with you so you understand who can access these programs. So in terms of employers, it's important to know if the employer is covered under temporary disability and family leave insurance. So under the law, employers must participate in these public insurance programs and deduct payroll taxes for employees working in New Jersey, or provide private insurance plan coverage that meets state requirements. The federal government is exempt from this requirement. It is important to note that temporary disability is actually optional for local governments. For example, counties, municipalities, and school districts. So those local government units do have the ability to just opt out of temporary disability. And generally, employees that in large part work outside of New Jersey are not covered. but we still encourage those individuals to apply to find out if they could be eligible. Next slide. Okay, so the other side of coverage after employer is to understand the employee coverage. So to be eligible, an employee has to work for one of those covered employers and also has to meet minimum earnings requirements. And this is really important because we think this is one of the areas that people might not realize they're eligible for these programs, but the earnings requirements are quite attainable. So for these numbers get updated every year, but for 2021, the earnings requirement is either 20 weeks total, earning at least 220 a week. Those weeks do not have to be consecutive, or a combined total of 11,000 in the base year. The base year is essentially about the 18 months prior to the claim, but it's the first 4 of the last 5 completed calendar quarters before the claim begins. And we like to remind people that workers that are not technically employees, such as properly classified independent contractors, are not eligible for these programs. But we do know misclassification happens where individuals are improperly classified as independent contractors. So we always encourage people to learn more about that. And we have a website dedicated to that at myworkrights.nj.gov. Okay, so that is the minimum earnings requirements and coverage for employees. So what benefits can you receive from paid family and medical leave in New Jersey? So these cash benefits are 85% of a claimant's average weekly wage, and it's capped. And this year's cap is $903 per week, and those numbers will be updated in 2022. And in terms of length of time, for temporary disability insurance, you could receive up to 26 weeks of benefits. A medical professional does have to certify for temporary disability, and the length of leave is determined by the medical professional. And for family leave insurance, you could get up to 12 weeks of benefits consecutively, or 56 days of benefits intermittently, which is about 8 weeks. Okay, Rebecca is going to jump in now and share about the different qualifying reasons for paid family and medical leave. Rebecca?
Thank you, Holly. I'm really glad to be with you all today. I'm the Outreach Program Coordinator here at the Department of Labor. Please pardon my mask and any interruptions that happen behind me. I am in a cubicle back at work. But yeah, here we go. So I'm gonna, like Holly said, I'm gonna get into more detail about why someone might be able to take paid family and medical leave in New Jersey. So the first one is if a worker needs to care for themselves. If they have a physical or mental health condition that prevents them from working, they could receive temporary disability insurance as long as a healthcare provider certifies the need for leave. This includes a few COVID-19 reasons, such as having COVID-19, needing to quarantine because you're exposed to COVID-19 and a medical provider certifies that you need to quarantine. This is during the period of being in a public health emergency. Or if a healthcare provider certifies that a worker is high risk for COVID due to an underlying health condition and therefore can't go back into the workplace. So there's a lot of COVID-19 reasons, but even outside the pandemic, this is really any physical or mental health condition that prevents someone from working. And as Holly said, this is up to 26 weeks as certified by the medical provider. The next reason you might take leave is if you need to care for a loved one. And if that's the case, you would take leave under family leave insurance. So this is if you need to care for a loved one with any physical or mental health condition. There's also a few COVID-19 specific reasons, such as your child has an illness or a health condition that prevents them from returning to school in person and therefore needs your care. A child who has a mental health condition such as ADHD and needs extra help with remote learning. So this isn't all remote learning scenarios, but these specific remote learning scenarios. Also, if a loved one is coping with domestic or sexual violence, you need to provide support for them, you could also receive family leave insurance benefits. For the reasons of caring for a loved one with a health condition or a child who has special needs, a medical provider would also play a role. They would certify that you are the caregiver in that situation. The definition of loved one is very, very generous in New Jersey. So when I say you can care for a loved one, we really mean anyone that you consider to be family. So this is the traditional definition of family, such as child, parent, sibling. It could be in-laws, it could be aunts or uncles, really anyone that you consider to be family. So it could be a partner that you might not be married to, but is your family. It could be your chosen family. So this really is a very purposely generous and inclusive definition, understanding that families come in all forms. As long as the medical provider certifies that you are the person or the worker is the person that needs to provide care to their patient, you could potentially be eligible for these benefits. The next reason I'm going to go into is if you're a new parent, and this is the most common reason we see, at least, for people taking benefits under these programs. So if you're a birthing parent, you might be eligible for temporary disability and family leave insurance at different times. So for pregnancy and childbirth recovery, we look at it as you're unable to work, you're physically or mentally unable to work. So you would receive benefits under temporary disability insurance. Typically, we see medical providers certifying for 4 weeks of benefits prior to the delivery date, and then 6 weeks after to recover from a vaginal delivery, or 8 weeks for a cesarean. With complications, a doctor might certify more leave, right? You get 26 weeks for your condition. So if you need to go on bed rest earlier, or you have a condition that makes recovery more difficult, or you have postpartum depression, a doctor might certify for more leave as well. Once the birthing parent is able to return to work and they've recovered, they could then receive family leave insurance benefits to bond with their child within 1 year of birth. So these things really fit together. Some parents transition seamlessly from one to the others. Some might take breaks, but this is a tip. I have here an equation for a typical list of benefits. So we have 4 weeks for pregnancy, 6 weeks for recovering from childbirth, and then 12 weeks, up to 12 weeks for bonding. So this could be 22 weeks total of cash benefits that a birthing parent could receive for their child. Bonding is not limited to the birthing parent, though. So the non-birth parent could also receive 12 weeks of benefits to bond with a new child within 1 year of birth. Also, in situations of foster placements or adoptive parents could also receive bonding within 1 year of foster placement or adoption. And again, this is the 12 weeks that we see for the other family leave insurance reasons. And then the last reason I'll talk to you about today is to cope with domestic or sexual violence. So if a worker themselves has experiencing sexual or domestic violence, they could use family leave insurance or temporary disability insurance, depending on the exact reason for leave. So family leave insurance covers coping with domestic and sexual violence more broadly. So this could include safety planning or seeking shelter. It could include going to court or preparing for court, or even recovering at home from the domestic or sexual violence, whatever that means. You could receive 12 weeks of benefits of family leave insurance. If a victim has medical, physical, or mental health conditions that prevents them from working as a result of sexual or domestic violence, they could also receive temporary disability insurance, just like any other physical or mental health condition. So we think this is a really important resource, especially in light of Domestic Violence Awareness Month. We're definitely hoping to push this use for your clients. I'm gonna pass it back on to Holly, who's going to talk a little bit about the job protection piece. We just talked about the cash benefits, so now Holly's going to talk about job protection.
Great. Thanks, Rebecca. Okay, so early on I mentioned how paid family and medical leave is made up of the cash benefits of our public insurance programs, and that these state and federal job protection laws are the other piece. And this can be confusing. We are very open about that fact because we've learned a lot from our outreach and from research that shows that understanding job protection can be a barrier to people taking paid family and medical leave. So we are doing our best to get this information out there and help workers understand how these job protection laws are important. Many New Jersey workers are covered under them, and we want that to be the main message that you help us put out there. Your job could be covered under these laws, so you can take that leave, return to your job, and during that period, you could also be eligible for the cash benefits. Okay, it's important to note though that our department does not enforce these laws. So if there is an issue with the right to return to one's employer after taking cash benefits, you would bring those questions to either the U.S. Department of Labor or the New Jersey Division on Civil Rights. So the first law we want to make you aware of, most people know about the FMLA, the Federal Family and Medical Leave Act. It's been around the longest. It generally applies to employers with 50 or more employees or a government entity, regardless of size. And the FMLA provides up to 12 weeks of job protected leave to care for your own illness or injury, including COVID, or to care for a spouse, child, or parent with a serious health condition, including COVID. And it also covers bonding with a newborn, newly adopted, or foster child. Now, in New Jersey, we have a law that covers caring for your loved ones that goes further than the FMLA. So if you are in a caregiving role, this is the law that you would look to for your job protection rights. This is enforced by the New Jersey Division on Civil Rights, as I mentioned, and it's a bit more generous. It generally applies to employers with 30 or more employees worldwide or government entities, regardless of size. And this provides up to 12 weeks of job protected leave to care for a loved one. And it is the generous definition of a loved one that Rebecca covered that we have here in New Jersey. So it's the equivalent of family. And this can also cover caregiving for a loved one who's been isolated or quarantined because of COVID during the state of emergency. This can also cover required care or treatment for a child if their school or place of care is closed due to a public health emergency. And this also covers caring for or bonding with a new child. Now, I'm going to cover how these laws interact with our cash benefits programs during pregnancy and recovery, because for a birthing parent, their situation is the most complicated because they could touch upon both of the cash benefits programs, temporary disability and family leave, as well as the federal and state job protection laws. So essentially during pregnancy and recovery, as Rebecca mentioned, an individual could receive temporary disability insurance benefits. And then while bonding with their baby, they could transition to family leave insurance benefits. Next slide. And for those same 2 periods of time, if the individual is a covered employee at a covered employer, their job could be protected under the Federal Family Medical Leave Act during the period of pregnancy and recovery. And then while bonding with their baby, they could be covered under the New Jersey Family Leave Act, providing them additional weeks of job protected leave. This is a point of confusion for many people, but essentially an employee eligible under our cash benefit programs and covered under both federal and state job protection laws, which again depends on employer size and other requirements, could take up to 12 weeks of FMLA and cash benefits from temporary disability for pregnancy and recovery, and then up to 12 weeks under the New Jersey Family Leave Act to bond, and at the same time be receiving family leave insurance benefits for up to 24 weeks of job protected leave. Our cash benefits, as Rebecca mentioned, are typically around 22 weeks. But as you can see, there's a lot going on here with these 4 different laws and programs, and we're trying to help people understand what they could be eligible for. We have a really great new handout that I will post in the chat when I have a moment that we want to bring your attention to. And it's a great resource to share with your clients who are parents. And we also have a special maternity webpage that we will share with you as well. There's one more job protection law that we want to make sure you're aware of. The New Jersey SAFE Act can provide up to 20 days of unpaid job protected leave to cope with domestic or sexual violence. This generally applies to employers with 25 or more employees and government agencies. And as with the other job protection laws, an individual taking leave under the SAFE Act could at the same time be receiving cash benefits from one of our insurance programs. Next slide. So, oh, my notes are just catching up here. Okay, so we want to be sure to mention retaliation. Unfortunately, it can happen, but it is unlawful for an employer to retaliate against an employee for taking or seeking to take their temporary disability or family leave benefits. And if this occurs, an employee does have the right to take private legal action. And retaliation can take many different forms, and we have listed some examples here, such as salary reduction, change in workplace responsibilities, and the like. So please keep that in mind. And Rebecca is going to give us a quick overview on applying for these benefits.
Yes, thank you. So we have quite a few slides on the application process, and I'm not going to go over all the details. You're going to get these slides after the presentation where you can take a closer look once you decide if these programs apply are useful to you. But I'm just going to go over a few highlights right now. So the first is that we really strongly recommend applying online. It's much faster. There's less room for error in the application, so claimants can get their cash benefits faster. However, we do have a mail and fax option as well. So we encourage you or your clients to apply online, and for you to help your clients apply online. If they need a paper application though, you might consider printing a paper application for them at the link attached here. Also for temporary disability insurance benefits specifically, so caring for yourself or for pregnancy, you can add a person to serve as a representative and help you apply and communicate with the Department of Labor about questions about that, about the claim. So as a social worker, you might consider being a trusted representative if that fits you. It might also be a family member or something like that. And yep, this is some more information. I'm not going to go into the details here. Just know that it's here in this slide deck for you if you have any questions. I'm now going to just review a few other quick tips we have for applying. First is to plan ahead as best as you can. We know things come up, but planning ahead helps you make sure you get the cash benefits when you need them. It's also really important to fill out information accurately and completely, because any incorrect information could delay your claim. So feel free to go through these slides. It gives you some of the bullets talk about common pitfalls in the application, so please pay attention to this. There's also a medical provider role in many of these applications. So for example, if you are receiving temporary disability insurance because you need time off work to care for yourself, a medical provider has to fill out their portion of the form to certify your need for care. And then same thing for if you're providing care for a loved one, their medical provider would have to certify their need for your care. And it is up to the person applying for benefits to ensure that the medical provider fills out their portion of the form. So it's important to, be persistent and communicate with your medical provider about that. The next thing I'm going to go over with you is part-time work and family leave insurance. So a worker who has multiple part-time jobs could now could receive family leave insurance benefits for one job if they take off from that one job and still remain working at the other jobs. However, the work hours at the jobs they remain working at can exceed their normal work schedule. And then their benefit rate would be based on the job they're taking leave from. I'm next going to talk about the connection between paid family and medical leave and unemployment insurance. So to receive benefits for unemployment insurance, you have to technically be able and available to work. But if there's a reason that makes you unable to work because you have a medical condition, or you're unavailable to work because you're caregiving or bonding, you would no longer be eligible for unemployment benefits. So to fill that gap, we have a hybrid program, but called family leave during unemployment and disability during unemployment. These are hybrids of our cash benefit programs for paid family leave and unemployment insurance. So you can transition to that program if you need. Information about that is on the link provided on the screen, and it goes into a lot more detail about how to apply and eligibility and what the benefit rates are. And then also, if you're laid off while receiving benefits, you could also be eligible for unemployment insurance. And our homepage, myunemployment.nj.gov, has a wealth of information about that. This is just our contact us slide. This information is really helpful if you have questions about your claim. So we'll have this in the slide deck for you to review. And that's it for the paid family and medical leave portion. We have a lot of FAQs and more information about the different scenarios organized by the reason for leave on our website, myleavebenefits.nj.gov. We encourage you to check this out. And now I'm going to pass it over to Nicole Risco, who is going to teach us a little bit about New Jersey earned sick leave.
And if I could chime in, Nicole, really quick and share with everyone that we started incorporating information about earned sick leave in our paid family and medical leave presentations because we heard that there's a lot of confusion around that. People aren't sure, should I be thinking about sick leave? Should I be thinking about medical leave? So we're really grateful for Nicole for joining us, and we hope that this can clear up any misunderstanding that any of you might have about these different types of leave. Thanks, Nicole.
Thank you, Holly. Thank you, Rebecca. Just to quickly reintroduce myself, my name is Nicole Risco. I'm a field investigator with the Division of Wage and Hour Compliance, and I am pleased to be presenting New Jersey's earned sick leave laws to you all today. So New Jersey's earned sick leave law is relatively new. It became mandated in October of 2018. For short-term leave, most employees are eligible for New Jersey's earned sick leave. Whether you work for a big employer or a small employer, no matter how many hours you work, employers of all sizes must provide full-time, part-time, and temporary employees with up to 40 hours of earned sick leave per benefit year, so they can care for themselves or for a loved one. And again, as my colleagues have mentioned, loved one is a very broad term, and many COVID-19 situations are covered under New Jersey's earned sick leave. Next slide. All right, moving on to permitted uses. Many of these you can use, again, for yourself or for a loved one. And these permitted uses include getting tested for COVID-19 or quarantining based on the advice of a healthcare professional or a public health authority. Whether you or a loved one needs to get the COVID-19 vaccine and recover from its side effects. You can use New Jersey's earned sick leave to care for your children when school or childcare is closed due to an epidemic, such as COVID-19. And again, in some instances, this includes mandatory remote learning. You can use earned sick leave to care for your own or loved one's physical or mental health condition or injury, including COVID-19, to address domestic or sexual violence against oneself or a loved one, or to attend a child's school-related meeting, conference, or event. All right, and the way New Jersey earned sick leave is accrued, employees accrue 1 hour of earned sick leave for every 30 hours that they work. And that's capped at a maximum of 40 hours per benefit year, but some employers choose to be more generous with their earned sick leave. So employers may choose to either advance employees with their earned sick leave at the beginning of the year, and they can just start using it at their discretion, or at that accrual rate of 1 hour per every 30 hours that an employee works. So in terms of what happens to unused earned sick leave at the end of a benefit year, an employee may be able to carry over up to 40 hours, or an employer may, excuse me, an employer may choose to pay out the employees for unused sick time at the end of the year. In terms of documentation, an employer can only require documentation for earned sick leave if it is used more than 3 days in a row. So if you take one day off because you're not feeling well, your employer can't require you to get a doctor's note. If the leave for need is foreseeable, you have a couple of appointments and you're going to be out for a few days, your employer can require the advance notice. But if the need is unforeseeable, your employer can only require advance notice as soon as practical. All right, and some permitted uses of New Jersey's earned sick leave overlap with temporary disability and family leave insurance. When it comes to your own medical condition, you can either use the earned sick leave or the temporary disability. And when it comes to caring for a loved one, you can use either earned sick leave again or the family leave insurance. And there are a few key differences between earned sick leave and paid family leave and medical leave. In terms of how the benefits are paid, earned sick leave is paid out by your employer because the employer is responsible for tracking the accrual rate and making the deductions from the accrual rate as the employee uses the earned sick leave. And for temporary disability and family leave, that's paid out by the state, which is a separate entity. In terms of the benefit amount, earned sick leave is paid at an employee's normal rate of pay, and temporary disability and family leave will be paid out, up to $903 per week, or 85% of an employee's average weekly rate, which will be different for each employee. And then again, in terms of documentation, when it comes to earned sick leave, the employer can only require documentation if an employee uses earned sick leave for more than 3 days. And for temporary disability and family leave insurance, which is a separate entity, again, the state will request documentation to supplement the claim. And then here we just have our contact information. You can find a lot of information about earned sick leave on myworkrights.nj.gov or at the state's wage and hour compliance webpage. And then we just have, again, our mailing address.
Thanks.
And I believe I'm passing it over to Holly.
Yeah, thanks, Nicole. So before we go to questions, we just wanted to share a couple important COVID-19 resources with you. This handout is available at this link. We get a lot of questions about vaccination and quarantine and COVID-19 as it relates to your job. So we created this top 5 things to know in New Jersey. It's available in English and Spanish. We encourage you to check that out. And then on the next slide here, we have some links that we think are very helpful. Unemployment insurance, myunemployment.nj.gov. There's also a page specific to extensions. Many people's federal benefits ended September 4th, and some individuals have questions about extensions. You can find that at that page. There's a great page that we created to help individuals whose federal benefits ended. It's full of resources and support in terms of childcare, housing, health insurance, and the like. So we hope you'll check out myunemployment.nj.gov/more-help. We also have COVID-19 FAQs. We have a specific webpage for parents and guardians, and a page about workplace health and safety as it relates to COVID. So we are happy to take your questions now. I think there's at least one in the chat that we can start off with. I'm going to put the survey link in the chat again as well, because we would love to have your feedback on our presentation today. And you can email any of us with your questions here if you would like to do it that way as opposed to putting it in the chat. We are happy to hear from you over email. But I think, Helen, I'm happy to read off the first question.
Well, I was going to ask if it's okay with you if we brought Keisha on camera and mic for her to ask her question. And then I've got a couple of questions that came in privately. So Keisha, would you like to come on and talk about your situation?
Sure, that's not a problem. So I'm a social worker and I work in a school, and I'm just wondering if, so my bonding time, I'm due in February. So by my calculations, after the federal program ends and I start with the New Jersey program, my bonding time would go into the summer. And I'm not sure if when my school is closed, does my bonding time still run concurrently with the summer, or would it pick up again in September when school opens? And unfortunately, my benefits coordinator is located in another state, so she's really not familiar. She wasn't even aware that we get the 12 weeks of the bonding time.
Thanks for sharing, Keisha. That's a really good question. I don't know the answer to the question about the Family Leave Act, the job protection, whether that runs through the summer break. But can you message me your email address and I will find out from our colleagues at the Division on Civil Rights? And
Sure.
As far as the cash benefit side goes for family leave insurance for bonding, we will also look into that. School employees, it's generally a unique situation with the summer break. And I know we have some specific guidance around that, so we can get that to you.
Okay, sure. Thank you.
Excellent. We had a point of clarification. You said that if there are employees that violate the law, then it's up to the employee to take private legal action. Did we hear correctly?
Yes, so that's for if an employer retaliates against an employee for seeking to take temporary disability or family leave insurance benefits, for either seeking to take them or for taking them. That is in the law. An individual has the right to take private legal action. When it comes to your job protection, your right to take the leave and return to your job, depending on whether it's your own condition or to caregive, you're going to have to go to the agency responsible for that. So I don't think the person clarified which scenario we're talking about here. But for those laws, there is a complaint mechanism where you go to either the USDOL for the Federal Family Medical Leave Act. You can file a complaint, you can call them, you can email them. And that law has a complaint process where they will help resolve that. And then in New Jersey for the Family Leave Act, if it's relating to leave to care for a loved one, that's who you would reach out to, the Division on Civil Rights. And there, again, you can call them. They have a hotline. They have an online complaint system where you would reach out to them. And I'll put both of those websites in the chat.
Wonderful. We have a question about delays. I know COVID delayed unemployment insurance. You know, I guess there were so many applications. Are there general, do you find there's general delays because of COVID with the other things that are going on?
So it depends on the application. I believe Rebecca shared a slide that talks about, it's typically, I believe 2 to 6 weeks. Once your full application is submitted is the average. Now, what we find, and we hear a lot, is that if your application requires the medical provider certification, so for temporary disability, or to caregive for a loved one who's ill or injured, that if the medical provider doesn't complete their certification quickly, it can slow things down. So we always encourage claimants to follow up regularly with their medical provider to ensure that that happens within a week or so of you submitting your application online. And again, as Rebecca mentioned, applying online is the fastest method.
I just want to add, this is slightly off topic, but related to the medical provider. A medical provider cannot charge you for filling out that form. They are not allowed to do that. So yes, make sure that, you or your clients aren't experiencing that.
Thank you.
That's good to know, Rebecca. Thank you. I'm not sure you'll be able to help with this, but it is a question that came in. Somebody's been waiting for their unemployment application to be approved or to be seen since April. And she was wondering if you had any recommendations of who you could contact, who she could contact.
Why don't we take that offline, Helen? I mean, we're not with the unemployment division. We know that for certain scenarios, depending on an individual's employment situation, there can be a lot of challenges. I'm really sorry to hear that. And typically, we can offer some advice, share some of the links that we have to see if any of those resources are helpful for you.
Thank you so much. That's really helpful. Okay, any other questions? All right, Libby, would you like to come on camera and ask your question? Come on, Mike.
Okay, sure. Am I on?
Yes, ma'am.
So I'm a social worker in a hospital, and I requested 6 weeks of leave to care for my mother who's ill right now. So I'm not sure if I was requesting it under FMI or FMLA. I did complete the paperwork. Her physician completed it. I'm in my 2nd week of leave right now, so I haven't received any payment. And I'm just not sure what I'm filing under.
Okay, I think I'll need to speak with you so we can help you figure out the family leave insurance piece of it, assuming that's what it sounds like you might have applied if there was a medical provider certification. Although for, you know, depending on your employer's requirements, you might have also had to submit that for taking leave under the Family Leave Act. So why don't I'll shoot you a message in the chat and you can share your email address with me.
Okay, sure. Thank you.
Thank you.
This is amazing. Thank you so much for your individual help and care. That's it's wonderful. All right, any other questions? You've got the experts here. All right, well, Holly's going to send me the handout plus the survey link, and I'll send it along to registrants. We'll also include the link to the recording here. Please share with your colleagues. You know, these are really important things, and we're glad to be in New Jersey with, you know, generous benefits to its citizens. If there are no other questions, we're going to give you 10 minutes of your day back. Yay. And I want to thank Holly and Rebecca and Nicole. And Holly, do you have any parting words?
I just wanted to say thank you again to NASWA New Jersey and to all of you for participating, and we appreciate your questions. They're really helpful for us as we continue to improve our outreach. And yes, the slides will be provided. We look forward to your input on our survey. I put the link in the chat once more in case you can link directly from there. And I look forward to following up with those individuals who had specific questions. And thank you. We really appreciate your time, and we hope you can help us spread the word about paid family and medical leave in New Jersey. Take care.
Thank you. Thank you, everyone.
Have a great day, everyone.
Thank you so much. Great information. Thank you.
Great.
You're welcome. Thank you.